My name is Bj Shaneman. I am a clinical nurse, an LPN. I have a master's and a baccalaureate in nursing science because the community is my love, and this is my gift, my way of giving back to all those that I love. A lot of my friends would say that Dr. Saunders and I grew up together, although Dr. Saunders was 80 at his passing, which was a few months ago, and I am 70 now. Dr. Saunders was not only my mentor, he was like a dad. He trained me the way in which he wanted me to be. So when you saw him, you saw me. When you saw me, you saw him. I could not have ever asked for a better educator, a better friend, and a father figure as I had with Dr. Saunders. He's been a part of the Mind, Heart, and Body program, which was started over 27 years ago. He's always been my program advisor, always available when I'm doing a health fair. I have a question, I can always call him in reference to a client. Dr. Saunders is my heart. He's my heart, and he'll always will be. Dr. Saunders loved every community we touched, every community. That's why Mind, Heart, and Body was such an important adventure for us because we did not belong to any particular church or organizational program funding and all of that. Our services are all free. All of the people that work in Mind, Heart, and Body volunteered their time, which gave us an opportunity to go anywhere we wanted to go.
What do you say to a new researcher who walks in today and says, how do I do research differently?
Know your community. I think that's something that I shared with you.
Absolutely.
That it is when you're doing research, you are working with the people out here.
Mm-hmm.
It is more than just the project or the money.
Right.
You have to know the individual in order to really do a good research
Right.
and to get the best candidate that you're looking for.
Right. Um, sometimes people say, well, where do you find patients? And I laugh because at some point in our lives, all of us either are patients or we have family members who are.
Hmm.
So, how do we get researchers to realize, it's simple. It is about being genuinely interested in people.
That's it. That's it. And I know for years when I did research for Dr. Saunders, the type of event that we are having today,
Mm-hmm.
I'm doing blood pressure and diabetes screening, and people with elevated blood pressures or diabetes,
Right.
they were given an appointment to come into my office for their management of care.
Right.
And if that showed that they would do well in the research study, that service was offered to them. So not only did we get them for research, but now they have management of health care and they
Right.
believe in you.
Right.
You know,
Right.
and I
Right.
have to say this with all my work that I am doing. Any patient that I have assigned to come see me, if for some reason they miss an appointment, they will call
Right.
me. And that's rare in a
Right.
doctor's
It
office.
sure
They
is.
will call me and say, Miss BJ, I'm so sorry, and apologize. But
Right.
then they will want another appointment.
Because they know you care.
There's a way of educating a person, but getting on a one to one thing. I
Okay.
often, when I work with clients, say if I'm working with somebody with cancer, I will say to them, you're never by yourself. I'm a two-time cancer survivor, and they
Right.
go,
Right.
what?
Right.
Or when I'm doing working with people with heart disease, and I'll go, yep, see my scar,
Right.
and they go, because one of the things is that
Right.
you are a nurse, you
Right.
are a health provider. How in the world
Right.
did you end up
Right.
having diabetes or high
Right.
blood pressure
Right.
or heart disease?
Right.
Now I've got them on the hook
Right.
because now we have a partnership we both
Okay.
share. I want to say that a lot of times we use the excuse, I will be all right. I
Okay.
know I
Okay.
did.
Okay.
I kept saying, I'm fine. I'll get over it. But I kept pushing, I kept pushing, I kept pushing. And the interesting thing for me, and I'm still trying to figure this out, when I had to have my triple heart bypass and a flip, I never was sick. Partying, having a good time and all that,
Right.
never got sick. Monday morning, went to
Sure.
the hospital for a simple
Right.
MRI for my arthritis, and they
Right.
gave me nitroglycerin, which
Right.
blew open my blood vessels
Right.
because they were so weak from my
Right.
arthritis, as well as cholesterol. And one of my surprises when my heart surgeon told me that my arthritis helped create my heart disease, I looked at him because as a nurse, I'm going, arthritis is a
Right.
bone disease.
Right.
And then he looked at me and he said, think about it, BJ. What is arthritis? I
Right.
had to realize that it is an autoimmune
Right.
disease. So when I am teaching and I say to my clients, I stand before you as a person with an autoimmune disease, they go,
Right.
what?
Right.
You got
Right. Right.
AIDS?
Right.
No.
Right.
Cancer is an autoimmune
Right.
disease,
Right.
arthritis, gout.
Right.
I was born with lupus.
Right.
All of those are
Right.
autoimmune disease. But I always say, but look at me. I
Uh-huh.
am out here doing what I want
Right.
to do. And physicians do not encourage their client
Right.
to allow them to do what they want to do. And the other thing is, physicians call their clients patients.
Right.
You're not a patient unless
Right.
you're sick in the hospital.
Exactly.
And
Exactly.
you've known me for years, and I taught you
Right.
that.
Right.
Whenever you're working with community people, they are clients.
Right.
They are not patients. Patients mean sick to
Right.
people because it is not fully explained to them that if you continue to smoke and continue to drink and your numbers continue to be extremely high, you could have, heart disease. You could have a stroke. Anything
Right.
can happen.
Learning to listen, is important. And I think we want to teach patients to ask good questions of their healthcare providers.
Right.
But we also want to teach healthcare providers and especially researchers how to listen, right? So the University of Maryland Patients Program, one of our slogans is that we listen to the voices of patients and then we make sure that the patient voice is incorporated in how we plan our research, how we do our research, and how we deliver solutions back to the community. How do we teach researchers and how do we teach clinicians how to listen to patients?
It is going to be extremely hard because they are working against a time frame. You have 2 minutes for a patient and that's it. One of the little things that Dr. Saunders and I did to solve that problem was that I triaged all of his patients.
Okay.
Because as his clinical research nurse, but as a triager, I had the time to listen,
Okay.
to answer questions. You know what I mean? She can tell me things that she wouldn't tell the doctor.
Right.
Example, I will do her triage and I'll walk in and give Dr. Saunders her information, and Dr. Saunders will say to the client, and how are you feeling today, Miss Jones? Oh, I'm feeling fine, Dr. Saunders.
Right. Right.
You see, you
Right.
see what
Right.
she went from all these things that are going on with her to tell this little nurse, but when she
Right.
get in front of the doctor now, it's like the God complex.
Right. Right.
You know what I mean? And that is what destroys relationships. One of the things that I tell all my clients, because I use the navigational healthcare system services along in my new center, first of all, they're to write questions down
Right.
and then present them to the doctor.
Okay.
The other thing is if the doctor says something that they do not understand,
Okay.
and if Dr. Saunders was standing here now, he'll tell you that that's true. They'll come back and ask me,
Okay.
what did he mean? What is this? And I'll explain it to them, or I'll say, let me call your doctor. I actually show and tell my clients how the heart beats,
Okay.
the importance of taking your medicine, what exercise do for you, what full sleep does for the brain. If they can see it,
Right.
now they visualize it and understand it often.
Okay.
I know before I open my mouth, if I say the word research, people are going to say, oh, you're looking for guinea pigs.
Right.
So what I do is I use my services of screening with their health disparities in order to put them into a frame of mind and show them where I can offer a service that's going to benefit them.
Okay.
That service just happened to be research.
Okay.
And then explain what it is the research is about. And give them an opportunity. I'm one of these people that I don't like to screen you and consent you today.
Right.
I want you to go home and think about
Right.
this thing, draw lines, and we will talk.
Right.
Because now I have given you that opportunity to prepare yourself for this.
Right. Well, this is part of the respect, right? The
Right.
respect for humans
You got to
is
have
saying
it.
that if we're really talking about informed consent, I should be able to think about my decision in more than 15 minutes.
Yes,
Right.
yes.
And I think that's part of the reason that patients sign up and then drop out of research
Right.
is they didn't really want to be in it, but they didn't have time to think through
About
it.
You
Right.
need to, whenever you're approaching a research client, those people need to be approached like they're gold.
Right. Well, also, I look at you and I think that you give people time, and yet I've seen you get 150 patients into a study much faster than the traditional way. So I don't think that taking your time means taking more time to get patients, right?
That's
Right.
faith.
Right.
That's faith. My clients, once they do a research study with me, most of the time they're calling me, Miss BJ, what do you have
Right.
available?
Right.
That is faith.
Well, this is the vision that I have, is that more patients would understand that research is how we find cures, how we find medicines that make people feel better. And I think if more people took the time to partner and to listen, and to be honestly interested in patients, that more people would be able to do research the way you do research,
Yes,
BJ.
that's true too. But I'm going to say this. A lot of times the client is not hearing, as you know, and I've
Right.
taught you this.
Sure.
They're not hearing that we're doing this for the
Right.
future of saving lives
Right.
and all of that.
Right.
We're doing this because you have this problem, and what we're doing with you, you never know. It may help your child,
Right.
your mother, your grandmother,
Right.
and it may be something that is in, for example, your genetics. Continue to serve and do what you do best. Research is one of those things, and I'm an old researcher from 50 years worth, so it is important. But make sure you are aware of what it is that you are doing to yourself or allowing others to do.